The advent of the project, which initiated through Health Workforce Australia and the Wicking and University of Tasmania, has been a fantastic opportunity. Aged care is a boom industry. It's going to be one of the biggest growth industries across the country in the next 20 years or so. I think the White House facility has opened up enormous opportunities.
This is a teaching aged care facility. So this is where we want to develop a nexus between teaching, research and practice. To have the money from Health Workforce Australia to really turn this building that was an existing Queen Victoria Home building into a learning centre is very significant. So a home like the Queen Victoria Home originally would have had 6 students a year. We've now increased that to 80 a year. So that's a 1,300% increase in the number of students. And that includes medical, nursing and paramedic students. What we've done is set in train a program to develop the capability of the organisation to support those students on placement.
Back at Queen Vic, just across the road, it's primarily for the residents there, and we understand that, and if we want to have a discussion amongst ourselves, or if we want to have a teaching session with the pharmacist or with one of the doctors, then there's not really a place that's appropriate for us, and neither should there be, because it's for the residents, it's not for us. And having a place like the White House where we can get away and do our assignments and have discussions with each other is really handy, and it gives us our own space.
They're really well set up here. They've got connections to their university internet accounts so they can keep up with their studies while they're here. They've got classroom facilities so they can sit in lessons. And it's a beautifully modified building as well, because there are parts of this building that are clearly heritage, and yet it's got all the modern facilities we'd expect in a training facility.
You know, it's teamwork effort, and you don't just get to care for them. You actually learn stuff about the residents as well as the staff, and you get to know them on a more personal level, and I guess that's beneficial for you as well as them. So it's been good to learn a different side of what a nursing home is about.
I mean, everybody wants to make a difference. Everybody wants to leave the world a better place than they found it. They're actually doing it. They're not in this for the rockstar wages. They're in this because they really want to care for older people. We want to give students a really good placement experience so they might think of working here.